Hello and welcome. Today, we're diving into a complex and often challenging neurological condition, autoimmune optic neuropathy. We'll explore what it is, how it affects vision, and what can be done about it. Understanding this condition is crucial for early diagnosis and effective management. The exact cause of autoimmune optic neuropathy remains somewhat elusive, but at its core, it's a case of mistaken identity. The body's immune system, normally responsible for defending against foreign invaders like bacteria and viruses, mistakenly attacks the optic nerve. This nerve is vital, as it transmits visual information from the eye to the brain. What triggers this autoimmune response is often unknown. Potential factors may include genetic predisposition, prior infections, or environmental triggers, but more research is needed to fully understand the underlying mechanisms. In autoimmune optic neuropathy, the immune system unleashes an inflammatory assault on the optic nerve. This inflammation damages the myelin sheath, which is the protective coating around nerve fibers, or directly damages the nerve fibers themselves. This damage disrupts the transmission of visual signals, leading to a range of visual impairments. Over time, if left untreated, this ongoing inflammation can lead to irreversible nerve damage and permanent vision loss. Determining the precise prevalence of autoimmune optic neuropathy is difficult, as it can often be misdiagnosed or underdiagnosed. It's considered a relatively rare condition, but its true frequency is likely underestimated. It can affect individuals of any age, but it appears to be more common in adults. There doesn't seem to be a strong gender predisposition, though some autoimmune diseases are more common in women. Further epidemiological studies are needed to better understand the distribution and risk factors associated with this condition. The signs and symptoms of autoimmune optic neuropathy can vary from person to person. The most common symptom is a sudden or gradual loss of vision in one or both eyes. This vision loss can range from mild blurring to complete blindness. Other symptoms may include pain with eye movement, color vision disturbances, such as difficulty distinguishing between certain colors, and visual field defects, meaning blind spots or areas of reduced vision in the field of sight. It's important to note that these symptoms can also be indicative of other conditions, so a thorough evaluation is essential. Diagnosing autoimmune optic neuropathy can be challenging, as it often mimics other optic nerve disorders. The diagnostic process typically involves a comprehensive eye exam, including visual acuity testing, visual field testing, and color vision assessment. An MRI of the brain and orbits is crucial to rule out other causes of optic nerve damage such as tumors or multiple sclerosis. Blood tests are also performed to look for autoimmune markers and rule out other inflammatory conditions. A lumbar puncture, also known as a spinal tap, may be necessary to analyze the cerebrospinal fluid for signs of inflammation or infection. In some cases, the diagnosis is made based on the clinical presentation and response to immunosuppressive therapy. While there aren't specific, universally agreed upon classifications or types of autoimmune optic neuropathy in the same way you might see with other diseases, it's helpful to think of it in terms of its presentation, acute versus chronic, unilateral versus bilateral, and the severity of vision loss. Some researchers also try to categorize it based on associated systemic autoimmune conditions, if any exist. However, the main focus remains on accurate diagnosis and prompt treatment, regardless of these sub-categorizations. The primary goal of treatment for autoimmune optic neuropathy is to suppress the immune system and reduce inflammation in the optic nerve. High-dose corticosteroids, such as prednisone, are typically the first line of treatment. These medications help to quickly reduce inflammation and prevent further damage. In more severe cases, or if corticosteroids are ineffective, other immunosuppressant medications may be used, such as azathioprine, methotrexate, or mycophenolate mofetil. Intravenous immunoglobulin IVIG therapy or plasma exchange may also be considered in certain situations. Close monitoring by an ophthalmologist and a rheumatologist or neurologist is essential to manage the condition and minimize potential side effects from the medications. Unfortunately, there is currently no definitive way to prevent autoimmune optic neuropathy. Because the exact cause is unknown, preventative measures are limited. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, may help to support overall immune function. Being aware of the symptoms and seeking prompt medical attention if any visual changes occur is crucial for early diagnosis and treatment, which can significantly improve the chances of preserving vision. The prognosis for autoimmune optic neuropathy varies depending on several factors, including the severity of the initial vision loss, the promptness of diagnosis and treatment, and the individual's response to therapy. Early diagnosis and aggressive treatment are associated with a better prognosis. However, some individuals may experience permanent vision loss despite treatment. Recent research has focused on identifying specific biomarkers that can help predict the response to treatment and the risk of recurrence. Newer immunosuppressant medications and targeted therapies are also being investigated as potential treatments for autoimmune optic neuropathy. Ongoing research efforts are aimed at improving our understanding of the underlying mechanisms of the disease and developing more effective treatment strategies to preserve vision.